Hey, Mama, welcome to the Navigating Postpartum Wellness Podcast. This is a community where you can feel seen, heard, and supported with relatable mom content to help you prioritize your wellness. Whether it's managing stress, reducing burnout, or simply finding ways to take care of yourself, this space is for you. Here we focus on making small, manageable steps toward feeling like yourself again without adding more to your plate. I'm your host, Jaree Williams, and I'm so glad you're here. Let's get into this episode. Welcome back to another episode of Navigating Postpartum Wellness Podcast. Your host, Jaree Williams, and today's episode is a powerful one. We're diving into the unspoken mental health challenges parents face, the identity shift that happens after birth, and the importance of these conversations, especially for postpartum wellness. I'm honored to welcome Dr. Jessica Vernon today. She is a board-certified OBGYN with 15 years of experience supporting thousands of people through reproductive journeys. She is the clinical director of product and an associate medical director. And she's amazing. She's also a mom of two. So who knows firsthand the realities of postpartum struggles. So she's here to talk about her new book, Then Comes Baby, and how her own experience shaped the way she cares for new moms. We're also diving into the identity shift. It's going to be so amazing. So let's get into it. Hey, Jessica.
Hi, I'm so excited to talk to you today. I think this will be a great conversation for us and for your audience.
Yes, most definitely. Thank you for coming on. So, you're worked with thousands of new parents. What are some of the most common but unspoken mental health challenges they face?
So, postpartum anxiety and depression are both so prevalent. I don't think people realize that about a third of new parents, we quote in the data like 15 to 20%, but really studies after COVID say close to a third of new parents struggle with anxiety and or depression postpartum. There's also a higher prevalence of OCD postpartum than people
Mhm.
really know, and it often goes undiagnosed. And another big one is up to 50% of new parents struggle with some sort of birth trauma. This doesn't mean that they had PTSD, but some sort of their birth experience was traumatic to them, and they carry that with them postpartum and have to process it at some point, and it really impacts their life in many ways as well. So all of these are very common things that people are struggling with every day and might not even realize.
Yes, that's so amazing how you were able to pull the data and how you distinguish between depression and anxiety. Because I know sometimes people use them interchangeably because they don't know. So, can you
Mhm.
tell us a little bit the difference between anxiety and depression?
Absolutely. And often they present differently postpartum than they do outside of that period. So people might also have symptoms and not realize, oh, this is really anxiety or depression. And we all know that in the first 2 weeks postpartum, you can experience something called baby blues, which is different than depression. And that's just from the very sudden, drastic drop in your hormones. Postpartum, it's almost like you're going into menopause overnight. And that caused these crying spells that you'll feel good one minute and then you're crying the next minute and you're just like, I don't even know why I'm crying, but then you're able to get out of it. It doesn't go deeper than that. It's not really impacting your functioning. Um, if symptoms go longer than 2 weeks or they're more severe, like you're feeling really sad, depressed, crying all the time, not wanting to get out of bed, not feeling like you can bond or connect with your baby. Um, Also, postpartum in depression, you can have anger and rage. That's very common where people are like, I just feel like I hate my partner and I'm yelling at them all the time and they don't recognize me and we can't have a conversation. That's a really common factor with postpartum depression. That's all something that has tipped over into more of the clinical diagnosis. Anxiety seems to be even more common than depression, even though we didn't talk about it as much. And we used to lump everything just under the word postpartum depression.
Mhm.
But anxiety is when that hypervigilance of a new mom tips over into, again, impacting your life and your functioning. Often you're just extremely overwhelmed. You feel very stressed and on edge all the time. You might have recurrent intrusive thoughts about something bad happening to the baby. And those things can cause you to like repetitively check on the baby or even avoid certain behaviors. Like if you have thoughts of the baby drowning, you might not want to bathe the baby because you're scared they'll drown. And this is where it can also tip over into some OCD as well.
Yes, I was just gonna
Um,
say that because I was like, "Yep,
yeah,
that's where OCD
yeah,
starts to kinda align
yeah.
too."
Exactly, exactly. And also one thing I always talk to parents about is like, are you able to fall asleep when the baby's sleeping? Because if you're sitting up ruminating at night and all these thoughts keep playing in your head at night, and you can't fall asleep, that's a sign of anxiety as well. And new parents can also tip over into having panic attacks. So when they have these out of body experience or things like chest pain, shortness of breath, um, they're feeling like something physically is really wrong with them. Some people even go to the emergency room thinking that they're having a heart attack and they're having panic attacks, but the people in the ER treating them wouldn't even know to ask, did you recently have a baby to,
Mhm.
check into that aspect of what's going on. So there's so many factors with anxiety and depression that just aren't routinely picked up.
Yes, because I didn't learn a lot of these things until I got my maternal mental health training certification.
Mhm.
And I was in there like, wow, like a lot of these things that are pushed under the rug is like you don't understand these things unless you are trained in it. So it's like bringing that awareness so that moms can be like, I'm not crazy, or people, like older generation will try to say, oh no, you're just going through a little phase, you'll be okay. It's like, no, like mental health is so important, especially like new moms and just parenting. It's a shift. It's like a big shift, and it's just like it has to be talked about more so that we can
Right,
identify
right.
this.
Yeah, and so many people are taught because of the stigma in their culture and society that like it's weak to have anxiety or depression and you just need to push through it.
Mhm.
But often these things you really need the help and support to get through it and to feel better and like yourself again. And so just trying to push through it, you end up struggling with it for longer. And people can suffer with this for years after they have a baby.
Yes, because it's like you're living in survival mode. So if you don't take that time to rest and address what's going on with you, it's like you're gonna keep going, and then one day you're just gonna like burn out, and you're be like, "Why
Mhm.
do I feel like this?" And it's like, no, your body
Mhm.
was holding all this stress, and
Yeah.
it's just a whole thing. Like I could go on and on.
Yeah, exactly, exactly.
Yes, and I know you've been open about your own postpartum journey. How
Mhm.
did your experience shape the way you approach your patients today, and how did that help you go where you are today currently?
Yeah, it changed everything I do. It changed the whole focus of my practice. I myself, when I was trained, we didn't talk a lot about postpartum depression and other anxiety and mood disorders. And so when people came for their 6 week postpartum visit, it's just like, how are you? How's the baby? Mainly focused on the baby. And oh, you're physically cleared to go back to normal activities. Um, and if somebody seems sad or tearful, you might be like, are you feeling very depressed or want to hurt yourself? That's about it. There
Mhm.
was no delving into other aspects of the emotional or mental health postpartum. And so when I had my own baby, we still weren't routinely implementing screeners on everybody. And my doctor didn't really bring it up. And so, of course, when I go to the postpartum visit, I'm like, I'm great. Everything's great. And I didn't know that everything that I was experiencing were symptoms of anxiety, depression, and OCD. And
Mm.
so I continued that way until my daughter was almost 2 years old. At that point, New York City, where I live, was in the middle of the COVID pandemic, and we were going on lockdown, and I just hit rock bottom. I couldn't function anymore. And so it was that point that I kind of self-diagnosed, and I was like, well, I do have a history of anxiety, so let me try some Zoloft and see what happens. And I immediately got like the perspective to take an exhale and be like, oh my gosh, this is what I've been dealing with the whole time. So at that point, after starting medication, I went to therapy and started doing other work to help recover myself. And then it became my goal to really ask the right questions to my patients, give them this non-judgmental space so they felt like they could share openly and honestly. And then comes the point where you diagnose someone and you realize you have nowhere to send them, who takes their insurance to a specialist, who works with people who are pregnant or postpartum and is comfortable prescribing medications for them. So I started working with some reproductive psychiatrists who are specialists in the field and getting some education through them. I also went to Postpartum Support International and got my perinatal mental health certification. So I started diagnosing and counseling and treating patients on my own as a primary care doctor. I can treat uncomplicated anxiety and depression. And so that became a focus of my practice. And also working to educate other providers, including new residents, on how to do this as well. And that's what I've done at multiple practices now, is I've kind of built out some mental health care and also getting therapists in the office so patients feel comfortable getting this care and knowing that it's so common. We even provide support right in the office. Um, and it's also led me to write this book because I hear the same things over and over that new parents are struggling with, thinking they're all alone in it, just like I did. And so I want everyone to be a little more prepared and understand the common things where we tend to struggle during birth and postpartum, and know how they can get support, and just kind of like give them a big hug and be like, I've been there and you're not the only one going through this.
Yes, you gave me chills listening to you talk about how, like, your own experience, especially as a doctor, like, you were able to, because you had the knowledge of it, you were like, okay, let me see, look at my family history and be able to know what I need. And now that you're using that to shape, like, you're making so much of an impact now. You know how many moms wish they could go to their doctor's office and sit in there and be like, hey, can you pay attention to me for a second? So, what tips would you give moms who are in postpartum, or even moms who are just like still going through these things, to get their
Mhm.
doctor to notice, like take the time to actually ask the right
Right.
questions?
It's so hard. And a lot of providers, because they're not comfortable having these conversations or they feel helpless, they don't know where to send people for resources, they just don't bring it up. Um, and so it can be really hard. So I would say, like, you can definitely talk to your doctor. You can also talk to anyone else who you think can be an advocate for you. It can be a nurse in the office. It can be a parents group you're going to. The pediatricians, sometimes they're really great because they see you more than the OB. So sometimes they're even better at talking about it. Um, Other people you know who've given birth and in your community who you feel comfortable sharing openly and honestly about are great people to go to and just start having conversations. Because the first thing is like feeling validated and knowing, yeah, I get it. You're not alone. This is so common. It is really hard. And even if you're not struggling with anxiety and depression, just acknowledging that having a new baby at home is a huge major life transition. And it's really hard, even if you have a quote unquote good baby, because I hear that all the time. Oh, I have a good baby. I should be happy. I should feel great and so blessed. And I don't know why I don't feel this unending love all the time. I'm like, that's normal, you know? So I think it's important to just feel like you can talk to somebody, no matter if it's your provider or somebody else. The other big resource that I will mention that is, I'm on the board of Postpartum Support International now, and they are just incredible. They are my favorite people. You can go to their website. They have free weekly support groups for
Mhm.
people who are pregnant and postpartum, that you can join. And they have a lot of tailored groups. Like if you're a military mom, if you're a Black and brown mom, LGBTQ, like they have so many groups where you can just find your people that it's really amazing. They also have counselors that cover the HRSA maternal mental health hotline, and you can call them any day for up to 30 minutes free and just speak to them and be like, I'm having a really hard day, or I just wanted to share this with somebody. And they will just validate you and provide support and help you find resources as well. And PSI also has databases in every state of people who are perinatal mental health certified, who are therapists, who are prescribers. You can look at the insurances that they take. And so it's just a really wonderful place to go all around. But yeah, I would say if you don't like, hopefully you have a provider who will stop and listen to you. But if you don't feel that or don't feel comfortable opening up to them, because a lot of people don't feel that they can open up to their provider, then there are other places and people you can talk to who will listen to you and create that space and not judge you and just help you and be your cheerleader.
Yes, that is so true, and especially with PSI, because I worked with the support groups for a while. And
Mhm.
then, being a mom, it's kind of got tough. So I was like, but I really did love it because it gives moms that community, that open space to just talk about things that are not talked about on a daily basis, and
Mhm.
with people who are just going to listen instead of like judging you or try to give you like advice when you're not asking for it. It's just like that open space. But I really do think PSI is doing an amazing job bringing that support. It's always like,
Yeah.
yay.
Yeah, and for some people, it's their first time, like, dipping their toe into any sort of mental health support, because I have so many patients who are like, Oh my gosh, if my mom knew I was considering going to therapy or going on medication, they would just judge me. They'd say go to church and pray or
Mhm.
just push through it and get through it. Or, there's just so many stigmas in society. And so for some people, I'm like, just go to the group. You don't have to talk the first few times if you don't want to. And you can just listen to other people being vulnerable and sharing. And you say, oh my gosh, I'm not alone. And that can be the first step. Because I know for a lot of people, like going one-on-one to a therapist can be intimidating, and often you have to go to multiple therapists to find ones you connect with. So even though that's also very important, especially if you do have anxiety or depression, like just kind of meeting even one other person who's going through or has gone through what you've been feeling is so validating and so important.
Yes. And it's just like it fills you up because you're like, it's not just me. Because
I
sometimes
know, I
when you're by
know.
yourself, you're like, is it me? But then like you talk to other parents and other moms and you're like, oh, okay, it's not just me going through this.
No, there's so much that's just not talked about in society because there's been this narrative created about what it should be like and feel like and look like to become a mom and how we should go through that transition. And it's just not the reality. And so we're stuck trying to measure up to this standard that's unrealistic, and unattainable. And that alone causes people to feel so bad about themselves and feel like they're failures.
Yes, that is so true. And that's where I'm not gonna go into a whole spiel of it, but I recently was reading a book as talk about how like you measure yourself against what you've already done versus like what you see externally. And that right there, once I learned about that, I was like, that is so true. Like imagine if we were taught to measure yourself against the things that you've already done versus trying to look at external factors. Because it makes you show up differently because you're not trying to compare yourself. You're just trying to become a better version of yourself.
Right. Yeah.
But let's talk about your book. Then
Oh,
Comes Baby. So you
yeah.
told us what inspired you to write it. But
Yes.
what was the hardest part of the book to write and why?
The so the book includes a lot of advice and stories and information, from both my personal experience, the things that I talk about with a lot of my patients, and the things that I've seen most commonly people struggling with, like when they go into labor and delivery, or when I see them immediately postpartum in the hospital or at their postpartum visit. Um, and so the hardest parts for me was kind of reliving the aspects of my journey that I really struggled with. And it wasn't that I'm not comfortable sharing it at all. I'm very comfortable at this point, but it just kind of like brought me face to face again with that version of myself who felt so bad about herself and felt so alone and so ashamed, and maybe like I shouldn't be a mom, and just kind of having to go back and sit with that version of myself and be like, it's going to get better. It's okay. So it's kind of doing like a little bit of self therapy through that
Yeah.
process. Um, but yeah, I didn't, it's over time you get some distance from it and you don't remember exactly how low you felt and how hard it was. And just kind of sitting with that and being like, that was a really hard time. It brought me all of those feelings back again. But it's good, like you were just saying, to compare to where I am now versus where I was. It's night and day. And having a second child and everything going so differently after the second one was just validation and just confirmation that like having the support and the help that you need and having the things in place and just having that knowledge this time made a world of difference.
Yes, that's how I feel on my my mom journey too. Like the first time it was rough. But the second time it was
Hmm.
like the silver lining. And so it's just like only if we can, get more awareness so that more moms don't have to wait till the second baby to feel like, oh,
Yeah.
I know better. Like, no, we wish you had it right the first time, so you can be
Yeah. I
aware.
know. I know. I didn't even think I was going to have a second one after the first. I was like, there's no way I'm ever doing that again. So it took years and a lot of work. And then I was like, I want to have a different experience.
Yeah.
And so I was so grateful that I was able to do it and get that experience that felt like, oh, this is what it's like to just like sit there and be grounded and like smell your new baby and look at their little fingers and just like breathe them in, you
Yeah,
know?
like just being present, like in the whole thing of
Exactly.
everything.
I was
Yeah.
not present, I don't think, most of the first couple years of my first life. So it's wonderful to get to have that.
Yes, because it's also too like showing how powerful writing is and storytelling because like even though you went through this journey and you've healed, it's just like now like someone who's gonna read your book, they're gonna read that and be like, this is where I am right now. And as they keep reading, they're gonna see where you came. So it's like your story is just going to impact so many moms, so many families just because you decided to be vulnerable and share that. So I want to tell you in advance, thank you for writing your book and just showing just different aspects of motherhood
Oh,
and your
thank
journey as a
you.
doctor. Let's talk
Thank
about that
you.
too.
Yeah. Yeah,
Yes.
thank you. It's so, I mean, I think it is important to, like I bring up in the beginning of the book, that I am, a white woman who lives in New York and very educated, and I have all these resources at my availability. But I do try to bring into the book so many aspects that are universal. And so even though everyone can't relate to me and my lived experience and like where I've come from in my background and all of that, I take care of people in New York City from every different
Yeah.
background, every different culture, socioeconomic status. And so there are these common threads that I hear over and over again. And those are the things that I felt were so important to bring, because it not only lets people feel connected and seen and like aspects of my story and my patient stories, but also like when you're out there on the street in life and you see a woman who looks nothing like you but has a little baby, you can be like, we are connected in some way. We are both gone through this very powerful transition. And, maybe give them a smile, help them carry the stroller down the stairs, like not give them a judgmental look when they bring out a bottle of formula, these sort of things where it's like, I've got you. We're all part of the same experience, and not, let's judge each other and compare who's doing it better.
That's so true because it's nothing like when you're out and about and like either your toddler's melting down or you need help
Mhm.
and a mom or someone comes out of nowhere and trying to help you. It's just like one of those moments like, thank you so much. And even though it means like, oh, for them, they're like, that's nothing. But it's just like, no, that meant so much to me. Like,
Yeah,
because
it
like you saw,
does. It
yes.
does.
And I love seeing moms like with new babies or like when their toddlers are melting down. Like, I see you. Like, don't we see like
Mhm.
you're in this. Like, even a funny story. We were at the park the other day and there was a toddler like melting down with their parents. And everybody was looking around at the park, like, what's that noise? And then we noticed, like, oh, they're just melting down. Like, okay, let's all go on with it. Cause it's just like we're not judging you because everybody has experience in that in some type of shape or
Mhm.
form. So at the end of the
Mhm.
day, like how you said, we're all connected going on this journey together,
Yes,
which is why
exactly.
community is so important. And before we wrap up, how did you come up with the title Then Comes Baby?
So I came up with the title from the old nursery rhyme, like first comes love, second comes marriage, then comes the baby in the baby
Oh,
carriage, because I feel like, when we all think when we're younger about when we have a baby, how it's going to be, it is kind of like this fairy tale, the same way, like, I'm going to meet this person, we're going to fall in love, we're going to have a beautiful wedding, and then we're going to have a beautiful family, and it's just going to be perfect. And so I wanted to kind of take that and flip it a little bit and be like, there is so much beauty and joy and love that comes with having a baby. And it's also really hard. And sometimes you want to run away.
mhm.
And there's so many personal changes you go through during this transformation and this journey on matrescence that
Yeah.
we just don't talk about when we think about that fairy tale vision of what motherhood is like. And so I wanted to kind of bring that in and start to change the narrative in that way.
Yes, I love that because sometimes the reality versus like what you dream versus reality, it could just be totally different. Like, yes, this happened, but it's just like it's not gonna happen as you want, but I'm okay with it, right?
Right, and it
So,
doesn't mean it's wrong or you failed at
mhm.
it, because so many new parents that I see think that if something didn't go according to their plan, whether it was the birth or breastfeeding or part of their postpartum journey, that they did something wrong, or there's something they could have done to prevent it, or there's something they could have done better. And I'm like, some things are just out of our control, and it doesn't mean there's anything wrong with you or you did anything wrong. And just hearing that alone, they can kind of like relax and exhale and be like, Okay, I needed to hear that. So I hope everyone gets that out of the book when they read it.
Yeah, especially when it comes to sleep. You know how every kid is
Oh,
different? Oh my goodness. Like even now I'm like some days I'm like, "Oh, what's going on?" Then I'm like, "No, you just have to go through the process." Even though they don't like to sleep all night or things like that.
oh yeah.
It's like go through the process. One day they'll be sleeping in their own beds in their room.
Well, I'm in New York and so many type A high achieving moms are here. And when I was in a new moms group, when my daughter was like 6 weeks through 12 weeks, one of the moms was already getting her kid who was a little bit older. She's like, we're doing the 12x12 program. This is the nap schedule. This is the bedtime schedule, like very regiment. And our baby was doing it. And I was like, my baby won't even fall asleep unless she's laying on me. So first things first, like I got to get her to go to sleep out of my arm.
Yeah.
And so it's just like I can't compare to any of that. Like sleep for every baby is its own journey.
Yes, for sure. And before we wrap it up, okay, what is one piece of advice you will give a mom who is in the thick of early motherhood?
I would just say treat yourself with compassion and remember that your health and your well-being is the number one most important thing for your baby. And so, whatever you can do to ask for help, set boundaries, take care of yourself in little ways is not just taking care of you, it's taking care of your baby. So we see you, we hear you, we've all been there. I promise it will get better. But while you're on this journey, just try to take some pause and give yourself a little compassion like you would for your best friend or anyone else in life and do the things you need to start to get healthy and thrive for you and your family.
Ooh, Jessica, that was great. Okay. Yeah. So y'all, if you need to listen to this whole episode again, replay it because it had so many gems. Share it with a mom friend because this right here, this is gold right here. Okay. So this conversation was powerful. I'm so grateful that you came on. And you guys make sure you check out the next Then Comes Baby. And until next time. Oh, where can our listeners connect with you and learn more about your work? Yeah,
Yeah,
good tip.
so by the time this episode is out, the book will actually be on sale. Right now it's on pre-sale, but you can get it at any place that you buy your books. And then my website is drjessicavernon.com. You can also find me on Instagram. I set a lot of boundaries with social media, but if I do see that you message me, I will write back to you, or you can find me on LinkedIn as well. So yeah, I'm happy to connect with anybody. And if you're in New York, I work at Oula, which is a midwifery-based practice with OB collaboration. So they're very holistic in care and really wonderful. So you can also find me there.
We love that. And it'll also be in the description. So if you're like, I have to get this book, just click the link in the description. And then till next episode. Thanks for listening to this episode of Navigating Postpartum Wellness Podcast. If you enjoyed it, I'd love for you to leave a review and share this podcast with a mom friend who needs encouragement. Be sure to join my email list at navigatingpostpartumwellness.com for more tips, updates, and resources to help you on your journey. I'll see you in the next episode.